Should I be worried about how asymmetric my eyes are?
It's been about 12 days since my non-incisional blepharoplasty with fat removal. The left eye is much more swollen, still bruised, difficult to open fully, and more tender than my right. Should I be worried that my left eye is healing so much slower than my right? I'm scared something went wrong and it's not going to get much better. Also, the doctor said that if my left is still like this by tomorrow, then he's going to lower the stitch. Shouldn't I not have a revision done when it's still swollen?
Thank you for your question. You submitted photos showing your progress from having undergone non-incisional Asian eyelid surgery with fat removal approximately 12 days prior. And you state in your question that the left upper eyelid is considerably more swollen and more tender, and is having with some difficulty with movement. And your doctor stated that if your eye did not improve, that the next day or day 13 would be the time when he would want to lower a stitch. And now you're questioning whether or not it's safe to do this procedure at a time when things are swollen. Well, I can certainly give you some guidance in this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, specialized in complex eyelid surgery for a variety of conditions, and in addition, I focus a lot on Asian eyelid surgery. So I can give you some guidance as to what I believe your doctor may be thinking at this time. It seems like you've definitely chosen a very good doctor, and and you made that decision, and your doctor wanting to intervene at a relatively early stage has to be for a reason. So I'll tell you what my thinking would be in this circumstance. And although it's been generally my policy not to operate on tissue that's swollen, there are always going to be exceptions. I mean, this is something that is very important to understand about clinical medicine and the practice of medicine. The training gets you to a certain point. That's when you're younger and you get trained. But then your experience, both good, bad, and everything in between, is what defines your style and your approach. And majority of that can never really be written and recorded in a way that is meaningful in textbooks or videos. It really takes first-hand experience. It's like the number of hours it takes to be a great pilot or a great musician. So to understand what is being done with Asian eyelid surgery, regardless of non-incisional or incisional, there is a part of this procedure which involves anchoring of the skin to a structure called the levator muscle. Now, the levator muscle is what lifts the eyelid, and usually that's the point where the levator muscle is engaged is at the ideal point where the crease should connect. Now, that being said, when you do this procedure, there is also a structure called the septum. And the septum is a more stiff structure that connects the bone and the upper eye and the upper rim or the eye socket to the muscle. And in Asians, that connection tends to be a little bit low. Now, when you open the septum, that's where you get the fat. And that's how the fat is removed, whether it's incisional or non-incisional. Now, I suspect your doctor may be concerned that some of that septum may have been engaged when the suture was placed to create this crease, and so it might be restricting your eye movement. Now again, this is speaking without a physical examination and without looking at the different levels of your eye movement. It's not unusual to sometimes get enough swelling that the eye can look low as it does in your photo. But if your doctor wants to move forward with doing something sooner rather than later, they may be concerned of either the septum or the engagement of the levator muscle in a way that might be restricting the ability of the muscle to open the eye fully. And in situations like that, there is a justification for earlier intervention. When we do surgery, whether it's for Asians or non-Asians, there's kind of a routine follow-up process, and then the door is always open so that we can identify opportunities should there be a need for intervention. So we see people not only, during surgery we actually have patients open and close their eyes, and we'll even sit them up and look at them to make sure that the crease and everything looks good. But after surgery, we'll see them at a week, and then at 2 to 3 weeks later, and then a month later. But if someone has anything unusual, we see them more frequently. So it seems like your doctor is really on top of this situation for you, and I think that if you trusted the doctor to do the procedure based on your understanding of the doctor's experience and expertise, then I think you should most likely follow your doctor's guidance and maybe ask your doctor what your doctor is thinking, so it'll help you understand the justification for the timing of intervention. So I hope that was helpful. I wish you the best of luck, and thank you for your question.